one of the oldest organizations. It's based in Geneva. And Dr. Amin, he represents the organization in the GCC countries. Dr. Fawzi for me is a brother, close friends, friendship which goes back to more than 30 years, working together in Bahrain. And then he moved here now. So it's so nice to have a very close friend close to me and in the same interest. Dr. Fawzi Amin is a consultant family physician. He was one of the pioneer who developed primary health care not only in Bahrain, but in the whole region. Bahrain was very advanced in its medical services and investing since a long time in the Bahraini population to become health professionals. And primary health care in Bahrain and family medicine was the top program in the region for many, many years. It started before other countries, maybe at least 10, 15 years before other countries as a training program. Actually, when I was the dean at the Arabian Gulf University, the top of the class in medicine, the College of Medicine, their first priority, they want to work in the primary health care because there was a very good role model. They don't want it to be surgeons like me or some, but they want to be like Dr. Fawzi and Dr. Shawqi and other colleagues. So they've created a real model. So today, I have the pleasure and honor to have him here with me. He has visited quickly the different colleges. Still, he hasn't been to the hospitals. And I thought he's going to present to you in a very informal way what is this humanitarian activities and the important role which you can play from the different specialties contributing to this noble cause. So I stop here, and it will be a pleasure having you with us, Dr. Fawzi, and to share your experience and what you are thinking about collaboration, particularly with Gulf Medical University. Thank you.
Good morning. Assalamu alaikum. I'm really impressed with my even short tour in your university, the university that you should feel proud of its staff, what the facilities there, and I could see the potential of having this university play an important role in the humanitarian activities. Now, also, I'm really honored and pleased when I met my close friend, Professor Hassam. And immediately when I spoke with him about this idea, and he really supported, and I said, let us go and have a presentation, a short presentation. So it's not a formal presentation. It's more of discussion, because in fact, I would like to listen to you. I'll propose something. I will say some ideas, but at the end of the day, it's you and we together will work to come up with something suitable, and it is designed for this university. I myself is a physician. I work in the Ministry of Health for almost 36 years in different positions, and I kept my clinical practice until last year. I engage also in medical education in both Arabian Gulf University and the Royal College of Surgeons in Ireland, which is the medical university in Bahrain. And I joined the Red Crescent since the time I joined the Ministry of Health. And it's almost more than 36 years. I finished even more than 40 years with the Red Crescent. And of course, I always felt, whatever I experienced within the Red Crescent, that a lot of things has to be learned and should be the medical school and all health workers, not just the physician, and even the nurses, they have a very important role in supporting the humanitarian work by the Red Crescent. So if I go to the next slide, this is actually PDF, isn't it? Okay. So I will not involve you with a lot of slides. I'm not really, we have time maybe next time to discuss a lot of issues. So I have only these 2 slides. And maybe if the time allow, we could show you some of videos. So what I intend to talk about is short introduction. And we'll tell you about this humanitarian world map and what the spectrum of and level of engagement in the humanitarian law, which could be potentially done through your university. And the most important part, which is here, is listen to you. This, I will not take more than half the time, and the next half an hour, it will be yours. You are the one who should also share in this discussion and give me your view and feedback and tell me your experience in this area. The movement itself, this, when we say Red Cross and Red Crescent, we are talking about 150 years of experience in humanitarian work. The story of Red Cross and Red Crescent, it's need by itself another session. So we'll not go in details of that, but it's a movement around the whole world. We have here in Emirate is the Emirate Red Crescent. We have 192 societies around the world. And usually the federation is only recognize one society per country. So there's no 2 society in any country, but there's branches. And even United States is only 1 American Red Cross. And we meet annually in Geneva. The headquarters is in Geneva. And they are considered as what they call them red pillar, equivalent to the blue pillar, which is the United Nations. So this is a red pillar because it started before the United Nations. And in fact, the federation, it's created after the pandemic of influenza, the Spanish influenza. In 1918, the Spanish influenza, and followed by creation of the federation. So federation is putting all the societies around the world. But Red Cross Committee is a separate body, which is unique to Switzerland. And it is the one who are looking after the Geneva Convention and all the issue related to the war and exchanging between the fighter in any war. So this is, in a brief, what's the movement? When we call the movement is both the ICRC, which is International Committee of Red Cross, the Federation, and those societies around the world. So imagine, you have friends all over the world. It's more like an embassy every place. You can organize anything. They're always together. They respond to any disaster wherever it occurs in any country. So that's a privilege that we can really make us with having a good connection with most of the world, and we can communicate, organizing, and of course, there is a lot of arrangement in helping each other. So this is in brief what this movement, but of course, it's by itself needs a session to tell you the details. Now, humanitarian world map, what I mean by that, unfortunately, the vulnerable people, those who are, when there is an incident or a disaster, those who are affected with the disaster, and a lot of time they are invisible. They are not in the map. People, they don't see them. And it is our duty to highlight those people, their needs, and bring their issues to the international agenda. That's the main thing, because there's billions of people that are not really seen. Those who are living in a camp or a refugees camp, they don't have address. It's not, they are not as if they are not exist. And what we need is really to go to them, to understand their needs and do our best to, and even not only to provide the care, but you can discover to turn them as an agent for acting on behalf of the Red Cross movement. They can themselves help themselves. So we don't want them to be dependent, but it's even makes them able to care of themselves. So the idea of the world map is really to focus to those vulnerable groups. In a lot of situations, you need to find out who's the vulnerable group in any community. The children, the immigrant, the elderly, all those people is potentially as a vulnerable group, and they are affected, and they have their own needs, they have their suffering, and we need to bring their suffering to the attention of the whole world. The media is focusing on mainly for advertisement and selling data, so there are not much of interest for those poor people. And we need to really understand that concept. They are invisible, and we need to bring them up and respond to their needs. Now, what's the role of the university? Now we go to the directly to this topic of this discussion. The way I see it, there is a spectrum of activity and engagement. You don't need to go in the place where the disaster is occurring. You can really, even at home, within the building of this university, you can contribute to helping those people. It can start very early, focusing on the issues that the whole world identified as something that we should also educate ourselves about it. Like, for example, the international, in this year, the International Day of the Elderly, which was 1st October. We'll have the 15th of November, the International Day of Diabetes. Vulnerability is, it's something transient. So you might, today you are healthy, but you can get sick, and that's, you turn to be weaker and vulnerable. And this is applied, somebody living in their country, in their house, and suddenly there's a war, and they turn suddenly to an immigrant. This is what happened to Kuwait, for example. We didn't expect, we said at that time, we are away from a war and even natural disaster, and it could happen just in a very short period of time. I experienced this with the Kuwaiti. People living in their luxury life in Kuwait. And suddenly, with the war of Iraq, immediately they become refugees in all the GCC countries. And they came to Bahrain at that time, and we make the headquarter of Bahrain Red Crescent as a headquarter for Kuwaiti Red Crescent. And the first thing they said, we need the training, we need volunteer, And I said, we have packages for first aid. They say, no, not first aid. We want people to carry dead body, and to bury them. That's what we are facing now. And they start to have, we design even a training with the Salmania Medical Center to take them to the mortuary and to train them to deal with the dead body. So a lot of situations just come just like that. And you can find yourself in another country where flooding, like now in Sudan and Bangladesh and anywhere. Suddenly, the situation, people lose all their, the houses, their belonging, and then become refugees. The situation of Syria. So the vulnerability everywhere, and we need to understand it and identify who is those vulnerable. And even in GCC country, you think, well, we don't have anything, we don't have vulnerable people. Then there is like the workers here who are, they are legal, if you consider them as migrants, but they are not, but they also suffering from psychological stress. They have their own need. A lot of them even go to suicide. And this is a specific vulnerable group identified in your area. And then you try to understand them, understand their attitude, their ideas, their knowledge, their behavior. And then you can design the way and to respond to their care. And this is one of the area potentially where the research, and I'm talking about even descriptive research. And I've seen today, really impressed the training center here for the volunteer. You can, as a university, contribute to the humanitarian community by providing information and knowledge through engaging some of the students in research, describing who are those vulnerable groups, what's their needs, what's their attitude, that is again not available for the charity organization, humanitarian organization, because sometimes they just go and thinking that they are responding to the need, but it's not actually that. So that is one area that university can really contribute. Again, I felt as a physician the need of all medical graduate and health worker, whether it is allied health or nursing and others, to be exposed to those vulnerable people, feel their suffering. Because we sometimes claim that we are just focusing to the disease and to treat the person. But it's the effect of that person, the impact of the disease. Sometimes we ignore it totally. Even the COVID today, it's not just the being, protecting yourself, but again, there is people, there is a stigma for people who have positive, how they live, how they, people behave with them. So there's so much area that needs to be explored. And potentially the university can really help in that area. Now, I'm just putting some of the picture. One in the top there, right side, is the role of the university to fundraising for a certain humanitarian agency. This is the Royal College of Surgeons. Yearly, they raise fund to the activity supporting Bahrain Red Crescent Society. Something could be done. This is the least in that spectrum. Just even sharing with those who are doing. So if you are not able to go physically and help, there is others, but keep them able to continue that role by supporting them through the fundraising. Through Royal College, they raise fund also for having to buy kind of toys for the children in Az-Za'atari in Syria. That was because we felt, we visited Az-Za'atari, and we felt that the children, they are really, they have a lot of time and they miss the playing. Even I've seen one bicycle and everybody in town, they are using it. So that's very important. And that was when we brought this idea to the section, or what they call it, the community engagement in Royal College. They said, we want to do something with that contribution. And we, as a Red Crescent, we send it to the Azatari. So this small even project shows how much you can engage and feel the need of those vulnerable people. There is another area that you need the medical staff, or I say health worker, including medical and nurses, other, to expose to issues related to the movement, which is the second picture is what they call it, the healthcare in danger. The attack which occurred during a war to the medical staff and even the ambulances. This is an area you need to understand what things govern this issue. And this brings us to the next slide, which is the emblem. As you could see, the Red Cross and Red Crescent and the crystal. Those the emblem which is mentioned in the Geneva Convention, mainly to protect the healthcare people who are providing a service for the vulnerable people, even during a war, at any time. So this is, we as a medical people, we're supposed to know. We have to know this, what's been even the whole world has provided purely is the protection of the medical people. So this is a legal issue, what they call it the international humanitarian law. That's by itself another area. And we as a physician, as a nurses and others, we should know the details about it, how it's considered even a war crime if you attack the medical people for providing the service. Now you can go further and also in more of participating in a project that help the vulnerable people. So it's learning, teaching, engaging, providing information, as we said, research. You can go further, engaging in providing service for the people in somewhere in your country or others. Now I'm putting example here of the water. Water, we are for granted here. We think it's just available. You can go to the tap, and for a lot of millions of people, they're suffering every day. They walking for 10 kilometers or maybe more just to get the water. It's in nearby countries. It's even in Sudan. I've seen it in Darfur and so many countries. So this community is so essential. And if it is not clean, it will end up by even diarrhea, and people die because just there's no clean water. As simple as this. And this is an area that potentially you can decide to do this in some country, or even support other agency who's really focusing on that. And you can think of any more than just water, the healthcare system, so many areas that could be engaging. The two pictures down is one, we are visiting in the hospital in Gaza after a war. And you could see the destruction. The children is the one who are really suffering during this. The young people, they are engaged in the war, but women and children will suffer. And those the vulnerable group, we need to bring also their issue, the attention of the community to help them. So it's in the medical field, we are the closest to the movement. And it's not fair that graduates finish their medical school and they just have no idea what's going on. And there is the need to consider not this activity to be done on an ad hoc basis. I'm sure you've done a lot, even now. You've done some of the Professor Hassam has told me about engagement with the Emirati Red Crescent and some activities. But the difference is to institute it within the university, to become part of the activity that you make sure that you do every month or every year, and you can feel proud. It will be part of your annual report. And that's, I've seen it in some of the universities whom we engage with, like the Royal College. They announce it even in their graduate ceremony, what they've done for community engagement as social responsibility towards the community. So the spectrum, as I told you, it's and the level of engagement could be within the campus, beyond the campus to the community, and beyond the country, and even to the region, to the international. It depends all in your time and how much you are enthusiastic to be engaged in those activities. Now, you are fortunate here in a way that I've seen, that United Arab Emirates by itself is very unique with their leadership at the top. They are committed to the humanitarian work. They created an international humanitarian city, which is between Abu Dhabi and Dubai. And they managed to attract all humanitarian agency here in United Arab Emirates. So you are in a very unique situation. That's really, we don't need to go somewhere to get contact with those agencies. They are representing here and our office in that city. And it shows how much, and you could see in the news how much the Emirates is really involved in any crisis around the world. So this is one pillar for enabling factor, I could say. Now, you're having a leadership, Professor Hussam, and I'm sure the board and the chair of the board and others also believe in the humanitarian work and humanitarian responsibility. So that's another enabling factor to make your any engagement successful. What is remaining is you, staff, student, to see how you are able to accommodate that within your, depends on your time, and feel flexible. You learn from, step by step. And you need also to have a kind of education related to this. And there's a very standard type of courses, the training in international material law. There is also different training, YABC, and it's been developed several years ago with the International Federation. And that could be also part of a formal training. It could be end up by a diploma, by attending those courses. And this will equip you to be engaged, and and it makes you, it will open the door for a lot of potential activities that you can engage with. So I have a lot of things to say, but I will stop here, as I promise you, because I need also to listen to you. I need to know about your own experience, even individual experience, and engaging with any humanitarian. And how could you see this be more expand to engage a group, engage the university as a whole? So myself and Dr. Sam, we discussed, the more we sit together, bringing a lot of ideas. And I think we can really together doing it, and you can be the leader and the region of taking this activity as instituted within the university. I know there's a lot doing, but it's an ad hoc activities. It's sometimes, not all the time. I keep the videos if we have time, but I prefer to listen to you first, and then we could, if there is any spare time, of course, we can see the video at any time. The video is actually from medical students in Arabian Gulf University who engage in visiting the cancer patient in Egypt. And they are doing now visit to Tanzania, to Zanzibar, to India, to different places where they themselves, they take the initiative. They don't wait even for the university, but I could see here the difference that potentially there is a will from the university itself to be engaged in this. Thank you very much. I'm looking forward for your. I just forget to mention, we at Red Crescent, we created a kind of calendar, and we have it also a kind of digital. This is identifying in each month an international day related to the humanitarian activity. And that's will put a plan for you. You can choose once in each month, one of those international, and usually those agencies who are putting this, especially UN, they put a theme, they provide all the reading material and things, and you could engage the student in it. So this is one of the activities to start with, and we hope even end up by having a diploma. Thank you very much.
Thank you, Dr. Fauzi, for this great introduction to the humanitarian activities. And as you want to listen to some of our students or staff, maybe Yara, you want to say something about the activity with Red Crescent, which took place. You can come here if you want. You know, Yara is also from Bahrain.
We have two clubs here. We have the Red Crescent Club, who is leader for here in Yara, and we have a volunteer club members here as well. So,
Okay, we listen to both of you. Who is one?
Would you like to come for the camera? I think there's some people following us.
I guess it's fine.
Okay.
Okay, so basically, last year we had an initiative from the Red Crescent, the Emirati Red Crescent. They came to our university. They wanted a team of students and volunteers so that it was a competition, مسابقة عون, the university own competition. But so they came and we had a big team, and actually we had almost 500 students from GMU join, register to be part of this. And we were expected to have 15 events, charity events, whether it was treatments, whether it was fundraising, whether it was food and everything. We had communications with the dental college, the physiotherapy college, all of the colleges to support. We even had the approval to have 50 families have free dental treatment and physiotherapy treatment and everything. Unfortunately, the pandemic happened. So we were not able to proceed with everything because of the pandemic. And the online education, online lectures was still not a thing, like now it is. But there was, as you say, a lot of students who were very interested in volunteering because after the presentation, they understood the importance of volunteering and everything. And I'm sure if there are opportunities, they would definitely be part of it. On a personal level, because you asked a personal, I'm part of an organization called Missions and Mercy, where we travel to Nepal and Sri Lanka and we treat kids, actually kids and grown-ups for free, without paying anything. It's only for dental. And now we're thinking of expanding. So this is on a personal level. If the Red Crescent talk to us again about having another team, I'm sure the university will fully support it. There's going to be another big, strong team. And now with the online lectures and events and all of that being, we adapted to it in a way, I'm sure we can find a way around it to make use of it in terms of volunteering.
Sure, I think it's an area of innovation also. I mean, you can really create your own. You don't wait even for somebody to tell you, but the Red Crescent, the Emirati Red Crescent, you say the club or a friends, we call it the friends of
We had a Red Crescent club.
Very good.
Yeah, we had a Red Crescent club in the university. We had our own
That's
room.
interesting.
Yeah, we had our own room where we had boxes and we set up toys and everything. We had an event that happened in the university before everything happened. Actually, it was sometime in Feb, which restricted everything, but it still happened. We had kids, music, food, games.
have you thought how you will do it through the presence of the COVID? I mean, because you will modify the way, like anything else, it's a normal life now with COVID.
Yeah,
So we
yeah.
need to.
Before it wasn't. That's why, everyone was scared and it was hectic everywhere.
So keep your idea, it can be developed, we can work together and how to also doing it in spite of the COVID.
Yes.
Well done, thank you very much. You can of course ask any question also, it's not, also the staff view, how you see it, that's been within usually the curriculum is restricting those extra activities and how it could be done in a way that's really suitable.
But this is there is one standard out of the standard of accreditation. There is community trend or something about
community engagement and outreach.
Okay, and that's another enabling factor, yes. Great. تفضل.
Yes, hello. First of all, I'd like to introduce myself. So I'm Maro. I'm the co-leader of the volunteer club that we actually made this year. Last year, I was part of the Red Crescent. I'm still part of it. When I saw that there are more than 500, or actually the whole room was full of so many volunteers who actually wanted to be, but unfortunately, we couldn't allow all of them to be with us as part of the Red Crescent team. So when I saw that there are so many people who genuinely are interested in volunteering, this year when we had the chance to make our own club, me and my friend went to this Virgil and we talked about making a volunteering club here in the university that will actually collect and gather the people who are interested in volunteering. So we can, me and the leader, give them access to many chances, to many opportunities. But I saw a lot of excitement actually when they wanted to become part of the Red Crescent team. So I was like, why would we not make them to have chances in any other opportunities or events? Even the university, when I thought if the university needed any kind of events, we can participate in it and help. We actually, till now, for 2 weeks, we gathered more than 90 people actually joined us till now, and we are growing more. I'm afraid we're going to become more than 100, I'm not sure. And we actually sent now a volunteering chance to become one of the medical assistants in one event that we help we help the nurses and the doctor in the supervision of some kind of patients. Even during the pandemic, it's true that volunteering was limited and most of the chances are online, but actually there are some other chances that we can do them, like chances that are not online. Also, we can participate in the online chances during the COVID-19. So we made the group and most of them actually here. So yeah.
Do you see this as an added value? I mean, is it something, how this will affect you as a physician if you engage with something related to helping?
Me, myself, at a personal level, I actually volunteered in so many events, even if it's not a medical event. At least when you go to a room and volunteer and you help, you gain some value, you get a lot of benefits. So that's why I thought volunteering is so important. I wanted all the people here in the unit to have a club or a place that we can gather and have a lot of ideas together.
Yeah, people always say this is a reciprocal type of thing. That although you're providing the service for those vulnerable people, but you will get a satisfaction. You will feel this exposure. You will know what other, the world also. When I mentioned about the water and everything, you just get a different way how those people. You will appreciate the way that you are getting all this for granted. And I think that's an added value for. Thank you very much. I look forward to also to sit with you and listen to you more in details, and we could work a lot of new ideas in this. Thank you very much.
Professor Shade.
I just wanted to talk about curriculum, because you were saying how this will tie into the curriculum. Now, community engagement and community outreach, right? think engagement, engaging the public, and then outreach is really
Go to
serving
them,
them
yeah.
more. And some people will classify this as an extracurricular activity. I think it's a co-curricular activity because it's not like sports or fun club or something like that. It's something that is close to the health professions in general. You know, medicine, pharmacy, nursing, medical lab technology, whatever. Because part of when we look at the program learning outcomes of all these programs, you know, part of it is advocacy. You know, being an advocate for your patient and being an advocate for your profession. So to build that in the students, these activities and outreach and all that will build this sense of, you know, this is my patient. I have to care for the patient. I'm not just like a carpenter who's taking a piece of wood out of that. And what we are doing in some of our colleges and programs, at least, is that we are putting marks on that as well. So that you know, we don't have only initially when we started, there's this group of students who always want to engage. Okay, but you know, these are by nature, they are community service people, they are leaders. But we are in an attempt to draw others. We're linking it, putting some grade on it and linking it to a certain course so it becomes something that is embedded across all the students in the university. Another thing is the recent establishment of the Center for Interprofessional Education, Research and Practice. This would be really very interesting to see, because many times we, as separate colleges, we will do a community engagement or outreach activity separately. Now having Crescent, maybe we can do it in an IPE approach. So more of engagement across different health professions, everyone serving in their own area. So I see a lot of potential for moving forward with these excellent ideas.
Thank you. I think that's another enabling factor. I agree with you. I mean, we need to institute it. It's not something just we treat it as something auxiliary, because it's so essential. The more we are spending this time with the activity, I realize how much I should, you know, engage the student from the beginning. It's not that later on they will know. And that is part of even it helps contribute to the mission of the university itself, because university can shape the community itself. So those students will be graduated with you know, all experience, wider experience, especially the humanitarian aspect.
Yes, actually, during the heights of the pandemic, we had our medical students, nursing,
The mic.
in the heights of the pandemic, we had the medical, nursing, dental, and laboratory students actually volunteering in the hospitals during the COVID. So we had this students volunteering, so 9-year students, the 4-year students going to the hospital, and they were taking care of patients along with the nurses and the doctors. So this is something they felt very proud of.
Sure.
And then we had 2 of the hospitals, of course, from the group. If you are today, you already mentioned in your talk that walk through the simulation center. GMU, along with the Ministry of Health, has taken out this volunteer. The country is already. We are also in the midst of a second pandemic, the second wave of so already training general public. So we have our own students from different professions going in as volunteers there. So they will be spreading awareness among the public. So the ministry is training them on how to spread their awareness and to know more about the COVID and also about checking the virus.
That's right. Yeah.
So this is going on.
I'm really impressed today when I saw this collaboration between the Ministry of Health and the university itself is supporting by training and developing those volunteers. It's really something not being done in most of the other countries. It's worth to be highlighted. Yes.
Hello, my name is Paul. I would like to speak from MBS. I would like to speak from the personal view of an international student. When I was coming to GMU, one of my little fears was how I would still give back to the community because in my home country, I started a charity that was giving back to the education sector when I was 16. So I was really looking for my own little niche of people that wanted to give back to the community. And that's really why I joined healthcare in the first place, because I feel that education and healthcare are the primary foundations of any community, country, whatever. So it was really interesting to come all the way here and find people that are so different from me, but so similar because we all share the passion of giving back to the community. I remember in the beginning, a lot of people were like, "Can you really do the Emirates Red Crescent?" Because primarily in Arabic, the whole thing wasn't really similar to me being back home with English-speaking people everywhere, but it was really a breath of fresh air to see that there's a community out there that's just like me, and also we share the same passions. And in regards to the World International Days, I really commend our college because in first year we had a mini project. So every group would be given one. I think I had autism. I learned so much. It was so eye-opening to understand that autistic kids aren't just, they're artistic, they're not autistic actually. So it's really something amazing to witness all of this and to see that there's so much more we can do, even with the pandemic going on, because we have a larger outreach. We can reach the international community, get them in, get other people's opinions. So I think, yeah, there's a lot we can do, even with the pandemic going on.
Beautiful. I think also to emphasize that one of the main principles in the movement is the humanity. Humanity is bringing people together. Even religion sometimes is bringing people away from each other. But it's impartiality, humanity. That's the very important principle. And we would like to see our doctors will be graduate. They will be built with this principle and their way of work. They impartial. They don't look to the race or sex of the patient or whatever. They really provide the needy for them and respect who are they. So this is another important principle. Thank you very much.
From the students, and I just wanted to shine a light on how education is very accepting of volunteers, and volunteers are almost always required. Despite the pandemic, I'll tell you three incidences where I actually went and volunteered. Besides that short period where we were absolute lockdown, there was a lot of opportunities to volunteer. There was a lot of obviously field hospitals everywhere, and they requested people with some medical background to come. So I worked with the Expo team, and they needed people who would test the people who are working for Expo. And the riot police wanted volunteers who would go around and look for individuals who aren't wearing their mask or are not abiding by the rules. Actually, tomorrow I have a training session in the hospital here. I think it's by Emirates group that's working around all of Ajman. So again, because we're hitting another wave, they require volunteers for all of this. So despite the pandemic, nothing like it never stopped for volunteering. There was always opportunities. And I'm not sure if everybody's aware, but there's a website called volunteers.ae. They're accepting of volunteers, all ages, all backgrounds. There's always opportunities in every different field. And I do encourage everybody to have a visit to that website and go ahead and volunteer.
I think also, as you mentioned, the UAE very specifically, there's a lot of foundation that really, that's the community, they eager to help. Now we have a project which will be run by the Jordanian University, Jordan University, training the refugees, the Syrian refugees for 1 year in healthcare, because that's been arranged also to be, and you know, the sponsor is Khalifa Foundation and Ben Zayed. So here there is a lot of even potential, as you mentioned, an opportunity that you don't worry even about the budget. I mean, once you have a really well planned project, you will find a lot of people to go with you and support you. So that is another area, just you remind me of that. You are fortunate with having this in UAE. There's so people just eager to wait for something to support and fund it.
Excellent. I think the level of interest is getting higher and higher. I really want to say just a few words again on this wonderful session. I just want to capture just some key words which were mentioned in this presentation, commenting on that also Dr. Sharif mentioned. Dr. Fauzi mentioned how to institutionalize what we are doing. I think this is a key element that we have to do to become embedded, integrated in what we are doing as multi-professional education in healthcare in general. Even the College of Healthcare Management and Economics, of course, you can look after the money and how to use it in an efficient way for humanitarian programs. So I think Sablo would be Professor Abu Bakr, the Dean of the College of Healthcare Management. So I see that definitely we can institutionalize that. And we started just a discussion now, just before coming here and after this presentation. Perhaps we are going to develop together academically multiple small certificates in different aspects of which can lead at the end by collecting this together to a diploma, which can be with integration, collaboration with integration. This could be taken by all the students from the different colleges and the faculty want to take it. So we need to develop this to institutionalize. We need to have it as part of the community engagement activities, because we are doing many things, but sometimes we don't know what's happening. So we need to collect it and bring it together. You and Matt, perhaps we can also collect this and on this. Community medicine. I think you have been doing, you have been doing many things with that. So I think we can incorporate this activity with community medicine, community health. Although I don't like the word medicine, other people, there's community nursing, there's community pharmacy, there's community dentistry, but they are the same. So it would be a great honor for us to collaborate in an official way.
Yes.
And then how to make it institutionalized, and this would be unique thing that didn't happen before. And even we can inform the CAA and we can inform the Minister of Education on this activity. But the success, of course, is only through you and by you, the students. With the support. From our side, we support to a great extent. And again, what you said, the project, how we are going to do it now with some of the challenges. And I believe there are different ways, because even many of the refugees somewhere they are carrying mobile phone.
That's right.
Mobile phone. So some teaching, communication, responding, they need to come up with ideas
but the connectivity is better without being physically in different places. So we need to find out how we can do that. Perhaps, I don't know, we can perhaps have a visit to the humanitarian city.
Yes, we can arrange that.
We can arrange it with Dr. Fauzi, which is on the border between Dubai and Abu Dhabi, so it will not have the problem of going to Abu Dhabi. So they can go there and maybe this will inspire and come up with some ideas related to that. So I will leave it to Bujou to try to arrange this.
Sure.
Just a small